Typically, we start to lose brain volume at about 5% per decade after the age of 40. There are certain diets that have been shown to reverse cardiovascular disease and slow down brain
Right.
aging. It's amazing how you put them through a full brain protocol. I've seen 50 to 60% improvement in brain function and perfusion to the brain. The most important things to look at are
Hey guys, Lewis here. Now, if you're learning a language, you're really going to want to listen to this interview. We're not going to be talking about language learning methods this time, but we're going to be talking about brain performance. So, if you want to play, let's say in the NBA, you want to play professional basketball, it's not sufficient to just train your three pointers and your jump shot and, all the technique and so on. You need to go to the gym, you need to work on your cardio and so on. And the same applies to language learners. If you want to learn a language, it's not just about the methods, it's also about, what's going on in your brain. Do you actually have the good hardware and do you have the brain performance to sustain this? So I highly encourage you to listen to this interview with Dr. Kristen Willeurmier. It was hugely interesting for me. So I hope you enjoyed it.
Lois. First of all, thank you so much for being a guest on your podcast. It's truly an honor. And it's so lovely to be able to speak to this audience of people who are bilingual and who speak multiple languages. This is truly a joy because it is one of the best cognitive exercises that you could do for the brain. So I think we're going to have a really fun discussion. So, with regards to my background, I have a bachelor's degree in psychology from Boston College, and I was really studying more cognitive psychology, and then decided I wanted to go a little bit more into the harder sciences. So I got a graduate degree, master's degree over at UCLA in physiological science and worked in a laboratory of neuroendocrinology. So I studied how hormones impact brain function. And then I decided to continue on and do another master's degree and PhD in neurobiology. And I studied Parkinson's disease. So, really
Right.
understanding why neurons die in Parkinson's. And then from there, I did postdoctoral fellowship as well in the same field, and then decided to go and work with humans because I love really sort of understanding the brain, and I took a job serving as the director of clinical neuroimaging research for the Amen Clinics. And for those who are not familiar, the Amen Clinics is a large, nationally recognized outpatient psychiatric center. And through doing that work, we were also studying ways to restore and repair brain function. And that really opened up a whole new world, not only for myself personally, to see how the potential of what we can do with our brain and how much we can improve its function just by modifying our daily dietary and lifestyle habits. But there's also some really wonderful advanced technologies that we can use to help improve and rehabilitate brain function. So, sort of the take home message from working in that clinical setting is that we can truly change the brain at any age.
Right. And I want to talk about the first sort of aspect that got me interested in your book.
Mhm.
First of all, I don't know if you mentioned it, but Kristen has a book available on Amazon. I read it about 4 or 5 years ago, Biohack Your Brain. I'll put a link in the description. I want to talk about brain performance and also as we're, getting older, how can we get sort of maintain or even improve our brain performance? So in terms of the big sort of levers, like the big factors that you can
Mhm.
manipulate to improve your brain performance and maintain it over time, what would you say that these levers are?
Yeah. So, first of all, thank you for taking the time to read the book. I'm truly honored. And I'm glad it inspired you to think about taking care of your brain health. So, when it comes to brain health, there's a couple of things that I think people should know. And I mean, those of us who are neuroscientists and study the brain know these sorts of things. But once you hit the age of 40, the brain has fully matured, and you sort of start this gradual process of brain slowing and brain degeneration. So
Right.
typically, we start to lose brain volume at about 5% per decade after the age of 40. The connections start slowing down, right? You start making less neurotransmitters. You typically lose about 85,000 neurons per day, which, in a brain that has 100 billion neurons, that's still a very small amount. But once you hit the age of 40, you want to be really proactive about taking care of your brain health. And so just sort of to start off with that, I like to give people a why. Like, why should we care about taking care of our brain? Why do we want to do it early, right? Before we have problems. And so they're what we call modifiable factors, sort of modifiable lifestyle factors that have been shown to be really important and impactful, right? There's the evidence based science to show that it's effective in slowing cognitive decline. And
Right.
some of them are rather, they're intuitive, but a lot of people don't do these things. So, sort of the most important things to look at are midlife obesity, midlife hypertension, and midlife diabetes. Think about just your health markers, right? Are you a healthy weight for your height? And, in a clinical setting where brain health was our top priority, every single patient that we worked with, we wanted to know, what is your body mass index? We want to get the lab values to see, right? Are you diabetic or pre-diabetic? Do you have hypertension? Do you have high cholesterol? All of those things impact blood flow to the brain and impact the integrity
Right.
of your blood vessels. So the whole goal is, let's get you to a healthy weight so you can become brain healthy. So that's number one. And to become brain healthy, and we can get into that more, there are certain diets that have been found within the evidence based literature that have been shown to reverse cardiovascular disease and slow down brain
Right.
aging. The Mediterranean mind diet being the one that comes to mind. So that's sort of the first big lever, if you will. Like, let's just get you healthy. The second thing is, we like to say, sort of removing toxic things in your environment. And it's very simple, right? No smoking and to
Right.
really limit alcohol consumption. And that sounds very intuitive, but again, when working in a psychiatric clinic, when you ask every single person, how much do you drink each night? A lot of people have a glass or two of alcohol. And
Hmm.
some people seem to think alcohol is fine for the brain, but really, if you want to preserve brain volume and also sort of the integrity of the connections between in the corpus callosum and just neuronal connections in general, you really don't want to be adding toxic things. So I tell people, if you want
Right.
to be brain healthy, you probably should limit alcohol.
Did you know that your personal data is being collected and sold by hundreds of data brokers without your knowledge or consent? Everything from your home address to your shopping habits is up for grabs. Data brokers harvest your information from public records, online activity, and purchases, and then they sell it to advertisers, marketers, and even scammers. This exposes you to identity theft, spam, targeted ads, and unwanted solicitations. Removing your data manually would take hundreds of hours. That's why I use Incogni. It's an automated personal data removal service that contacts data brokers on your behalf and legally forces them to delete your information. Incogni handles the entire process, from sending requests to following up and ensuring compliance. Incogni has been a game changer for me. Within the first few weeks, I noticed a drop in the number of spam emails I got. What really impressed me was the dashboard. I could actually see which data brokers had my information and watch as Incogni got them removed. It's incredibly satisfying seeing those numbers go down. The best part, I set it up once and I just forgot about it. Incogni keeps working in the background, continuously monitoring for new data brokers and removing my information. It's like having a personal privacy assistant that never sleeps. And knowing that my personal address and personal details aren't floating around on some sketchy websites anymore, that peace of mind is priceless. I honestly wish I'd got started sooner. So take your personal data back with Incogni. Use code Talagran at the link below and get 60% off an annual plan.
Third thing is, and again, this is very intuitive, but doing cognitively stimulating activities. So as many of people who are going to be listening, they're already bilingual or learning multiple languages. And I would say that is probably the evidence for that. That's the most robust way to work your
Right. Right.
brain and brain networks. But when people age, and especially when they hit retirement, it's amazing how people start to slow down cognitively. So we want to really make sure you're engaged in cognitively stimulating activities. The next thing, again, it's very intuitive, but being physically active. And as you saw, during COVID, the World Health Organization actually changed their guidelines to make sure that people were moving at least 150 to 300 minutes a week. That's like
Right.
30 to 60 minutes of exercise 5 times a day plus resistance training. So you want to make sure you're moving and you're exercising. And then Some of the less intuitive things, but very important to brain health, are treating psychiatric disorders. So things like depression, untreated depression increases your risk for dementia. And a lot of people aren't aware of that, but so we want you to treat that. And sleep is really important. So at least in our clinic, we really made sure that everyone had a sleep evaluation, or those we
Right.
suspected might have sleep apnea get tested and treated. So there's a billion people who have sleep apnea worldwide. And that's basically when you stop breathing hundreds of times throughout the night. So you essentially
Mhm.
limit oxygen to your brain. So untreated sleep apnea doubles your risk for dementia. And many people sort of associate sleep apnea with being overweight, but it actually can occur in people as they get older. It's more common in males. It's more common in people who smoke and have hypertension. So, as we get older, that sort of soft pellet starts to relax and close the airway when we sleep. So, just make sure that, you've got good sleep habits. And if you have sleep apnea, we want to get that treated. Other things that are important, making sure that you have your hearing tested. And if you're older, so if anybody's listening and they're 70 years of age or older, get your hearing tested to get hearing aids. That's been shown to
Right.
actually help preserve cognitive function, right? Because if you stop being able to hear sounds, those pathways in the brain start to deteriorate. So,
Okay. Right.
these all are very they're things that are not hard to do, but when I'm first working with people, it's just a checklist, sort of like the pilot's checklist, right? Are you at a
Mhm.
healthy weight, right? How's your blood sugar? How's your cholesterol? How's your blood pressure? Do you smoke? Do you drink? Are you cognitively active? Are you physically active? Right? So these are all what we call the modifiable risk factors. And if all of those are healthy, right, and those aren't things that we need to address, then you're doing great. And we can then work on the more proactive strategies. Right now, what do you want to do to sort of proactively take care of your brain health and preserve it?
Right. So, and assuming that you're taking care of all these measures, all of this, physical exercise, not
Mhm.
smoking, sleep, and so on, what's the difference between, let's say, two people who have the same sort of genes? Well, that's not really possible unless they're twins.
Twins.
But so two people like this, and one does not take care of all the factors that you mentioned, and the other one
Mhm.
is going to be, super like perfect in all these areas. What sort of improvement can we see? Is it, I know it's hard to put a number on it, but would it be 50% or 100% to 100%?
Well, I love that you asked that question. And part of the reason why I can at least give a little bit of a ballpark answer to that is the particular neuroimaging clinic that I worked in. I had the benefit of seeing thousands of scans, right?
Mhm.
We had a brain imaging database that had over 150,000 scans. So when you scan everybody's brain and you see what's going on, what I started to notice was most people's brains, even those that were healthy, had areas that had low perfusion or low blood flow. So I learned very quickly that perfusion to the brain is really important. And it really depended on, and it's going to depend on a person's whole history, right? So if you're coming in to see us and we scan your brain and the perfusion is good, and we're just going to do things to help optimize your brain, the the percentage change might be very small. That might be a 10% increase, but 10% increased perfusion in the hippocampus, or an area that's critical to learning and memory, or say your prefrontal cortex, which would help with focus and attention, is very meaningful. Alternatively, if people have played contact or collision based sports, right, and their brains have been exposed to a significant amount of what we would call repetitive neurotrauma that can damage the
Right.
cells, right? Or say it's a moderate or severe traumatic brain injury or exposure to toxic mold, or perhaps they've been on chemotherapy medications for cancer, and chemotherapy can also be toxic to the brain. So all of these
Really?
different
Okay.
factors, yeah, all of these different factors can influence the perfusion to the brain. And so or say somebody who comes in and has mild cognitive impairment or dementia, and we scan their brain and we see very low perfusion, say in the frontal and temporal lobes or parietal lobes. There are things that we can do, both dietary and lifestyle wise, but also There's more advanced technologies like the hyperbaric oxygen therapy that can regrow blood vessels in the brain. So when you rescan them, so you put them through a full brain protocol, I've seen 50 to 60% improvement in brain function and perfusion to the brain.
Really? Wow.
And it's spectacular. And this is where people have their before and after brain images, whether those are
Right.
the electrical images or the functional images. This is where brain imaging can really transform the way you think about taking care of your cognitive health because you have objective measures, objective data to see what you're doing is making a measurable difference. And it's, by the way, it's part of the reason why I wrote the book, Biohack Your Brain,
Yeah.
because prior to being in a clinical setting, I did not know this level of restoration of brain function was even possible. And now that I have seen it in individuals of all ages, right, from teens all the way up into their 90s, and seeing you can have somebody who's 80, 85, or 90 still go through a brain health protocol, even if it's just dietary, lifestyle, and nutritional supplements. It doesn't have to be
Mhm.
anything fancier than that, that we could still improve perfusion to the brain and we can improve cognitive function. It was remarkable. I wasn't even aware that it was possible. Now that I've seen it, and it seems quite normal to me because that's the whole goal. Every person that we worked with, whether I was at the Amen clinics or anyone I currently work with, the whole goal is how much more efficient can I make your brain? How much
Right.
more can we bring blood flow to the brain? And because your brain is dynamic and it's changing, and every single thing that you do every day makes a difference. Everything you drink, everything you eat, everything you watch, like your brain is constantly learning and taking in all of this information and taking in everything that you put into it. And the output could be very positive if you have enough good inputs, right? And this is where that lever that we were speaking of, dietary and lifestyle habits, can be a very strong influence on your cognitive function and your cognitive proficiency.
This is great actually, because I didn't think that we had such a sort of margin for improvement. I do have another question, which is
Mhm.
super specific. I
Of
think of
course.
this, almost like multiple times a year since I read your book. But you talked about blueberries and just, I guess,
Yes.
berries in general.
I have them right
And
here with me, by the way. I had some blueberries and water just before I got onto our podcast.
Really? Well, actually, I have some blueberries as well, which is pretty uncommon here in I'm in Tahiti and French Polynesia, so
Oh,
I have to
nice.
buy them frozen. Otherwise, the fresh ones are super expensive. But the blueberries, it seems like there's some research on it, or at least, or maybe a lot of research. I also I don't know if you know the website examine.com. I saw that, blueberries were listed as like a top sort of food for brain health, for aging as well. So I just want
Yes,
to ask you how big of a deal is this? And also, second question, this is purely for my own
of
interest.
course.
I don't like blueberries. I don't like the taste of it, but if
Okay.
they're cooked, like I don't know, pancake blueberries or blueberry muffins maybe, then that's fine. So
Oh
is
my
this
god, if
still
they're cooked in a
okay or
baked goods, well, I would prefer that you have them fresh and not cooked or
right,
frozen or put into a smoothie, but yeah, the evidence-based research shows the 2 types of foods that are really the most neuroprotective and best for your brain health are the leafy greens and berries.
right,
So you could do blueberries, strawberries, blackberries, any sort of berries, and it's really because of their high, ORAC levels. So they actually protect and preserve cell membranes, right? So part
right,
of why we have, brain degeneration is that our cell membranes get attacked by free radicals. And so
right,
really as we age, we want to make sure we have diets that are really high in antioxidants. So if you don't love blueberries or raspberries or strawberries, it's just not your thing, then I would say you could still have various kinds of fruits and vegetables, and then you could supplement with high antioxidant supplements like vitamin C, vitamin
okay.
E, and acetylcysteine. So you can lean in on supplements if you need that. But I still always prefer to get it from the fresh fruits. And you're having them in the baked goods, so you make me you make me laugh.
Yeah, I guess the problem is I was wondering if like cooking them at a high temperature would kill the nutrients or change them in any way.
It is possible depending on how how you cook them, but at least you're getting them in your diet. So I will take that as a positive. And you want to try to have it frequently. So when I teach people about, the best dietary habits for your brain health, you want to be having 2 servings of fruit per day. So if it's not berries, do you have any other fruits?
Typically bananas, yeah.
Okay, I'll take it.
Okay,
Yeah,
yeah. And so when we're talking about a serving of blueberries,
a
for
cup.
example, daily, a cup. Okay,
Yeah,
so that's quite a
yeah.
lot actually.
Yeah. I
Okay,
mean, they're high in fiber, right? They're nutrient dense, they're filled with water. So, again, brain healthy is really about what are the kind of foods that you can eat, whole food, plant-based, minimal cooking, minimal processing,
right, right,
for your body to just sort of easily break it down and assimilate it, and all of those things are important because really brain health is about what are you repeating? What sort of patterns are you repeating that are healthy for your
okay,
body? And that's, I think, one of the most important things if I were to sort of project a message to your audience is like, if you can get 3 servings of vegetables and 2 servings of fruits in per day, every day, over the course of a decade, you're going to start to see that those turn into meaningful, changes in terms of
right.
preserving your cognitive health. So it's about repetition in the foods you eat. And a lot of people, have processed foods. Processed foods are part of the normal dietary, you know, standard American diet. At least that's what they
Right.
do here in the United States. So just the more you can lean in on clean, unprocessed, fruits, vegetables, nuts, seeds, healthy, lean proteins, and keep the sugars low. Because I will say, you're talking about, what are some of the levers we can lean on to preserve our cognitive health. One of the things that I used to teach in the brain directed weight loss group was let's track the number, how much sugar are you having in a day? And
Right.
I would have them read labels. And the American Heart Association essentially says women should have no more than 25 grams of sugar per day. Men should have no more than 37 grams of sugar per day. And I will
So,
tell you, most people consume more like 80 to
right.
90.
Oh
Yeah,
yeah, for
it's
sure.
very
Yeah.
common. So this is where I had people read food labels. And if the grams of sugar were more than 5 grams per serving, then I would say put it back.
Right.
So this is the type of thing, and this is just practice, right? Having somebody sort of teach you, here's sort of the healthiest way to eat for your body. And, why is the sugar important? We don't want you to be diabetic or pre-diabetic, right? That damages your blood
Yep.
vessels. If you have damaged blood vessels, that could put you at risk for a heart attack, stroke. And as we age, people get hypertension, heart attack, stroke, seizures. I mean, and I see it quite often. So the things that you can do to really the foods that you can eat to really protect and preserve your cells and your blood vessels, it's really an investment in your long-term health.
Right, and talking about sugar actually, because I track my calories and so my,
Good.
macronutrients as well, and I always pay
Mhm.
attention to this specific sort of column on my daily sort of intake. It's added sugars, but should I
Yes.
also be concerned about the sort of total amount of sugars? For example, if I eat a banana, that's not going to account for, added sugars. Is this
Good
still a
question.
concern?
I do love that question. So when I have people track, I do track everything from the bananas to the
Right.
blueberries to the packaged foods. And I still prefer, like, if you're going to take in more sugars, but they're going to be from fruits and vegetables and healthy foods, I'm not as concerned about that. Usually we're really working on eliminating so a lot of times people are
Okay.
taking in excess sugar just from fluids that they drink, but also packaged foods. So, but yes, I want you to track them all. And I will tell you,
Okay.
I'm a big fan of dried mangoes, and when I worked at the clinics, it was an hour drive, and I used to get a big green juice and a thing of the dried mangoes. And then I actually saw how much sugar and calories they were, and I was like, wow, I'm just sort of
Yeah.
mindlessly eating these foods that I think are really good for me. So I'm just, you know, because I teach this to people, I teach people how to be brain healthy and how to eat brain healthy. I follow the same, you know, guidelines I give people.
And could you talk a little bit more about this Mediterranean? I think you said at one point Mediterranean mind diet,
Mind
or
diet. Yeah.
right.
So the mind diet is a combination of both the Mediterranean diet and what's called the DASH diet. So DASH is the dietary approach to stop hypertension. So it's a
Right.
combination of both. And again, the Mediterranean diet is just, tends to be more plant-based, but you've got your
Hmm.
vegetables, your fruits, your lean proteins, nuts, seeds, fish, olive oils, low in saturated fats, low in sugars. And then
Right.
the dash component of it is also low in sodium. And really that the research on that started to expand in 2015. Investigator named Marcia Clark Morris over at Rush University had led a study in almost 1,000 people. It was called the Rush Memory and Aging Study. And she followed them over 17 years and tracked their dietary habits. And those who followed this, what we'll call the Mediterranean mind diet, and again, it's very
Hmm.
prescriptive, um, were shown to just be cognitively healthier. So their brain age was 7.5 years younger than those who are just
Right.
on a
Right.
standard diet, and they reduce their risk of Alzheimer's by 53%. Those are the people that follow the prescriptive diet very rigorously. Those who followed it moderately, they reduce their Alzheimer's risk by 35%, but still main, maintain their cognitive function. They were 4.5 years younger than their contemporaries who did not follow that dietary plan. And even the diet that I teach in the clinical setting is very prescriptive, right? There's a
Right.
certain amount of fruits, vegetables, legumes that you get, and it's modifiable. And if you follow it, you will tend to lose weight, right? You're just
Hmm.
metabolically healthier, and we stabilize, you know, the blood glucose, get the
Hmm.
cholesterol into a healthy range. So it's helps with all of your health markers. And that's why I really like that dietary approach. There's many other approaches that people can take. I know some people do ketogenic, some people do omnivore. Everybody, is welcome to follow sort of the diet that works for them. Usually I say take the Mediterranean diet and then sort of modify it to, what your eating preferences are,
Right.
if that
Right.
makes sense.
So in terms of, it's more about diseases that we may have later in life, Alzheimer's, Parkinson's, dementia.
Right.
If someone were to implement all of these, measures, diet, sleep, and so on, how much of a chance do we stand of, just avoiding these diseases altogether?
That's a great question. So remember, I was talking about those modifiable risk factors at the beginning of the
Hmm.
podcast. So if you did all of them, you're at the healthy weight, you're doing your cognitive exercises and brain training, um, that can help. They say it's like 30 to 40% reduced risk of dementia, which
Right.
is
Okay.
that's a
It's
very
huge, yeah.
meaningful, yeah, that's a very meaningful number because your brain is going to age and these diseases of aging happen, right? The number one risk factor for Alzheimer's is age. So
Yeah.
anybody who's 65 and older, 65, your risk is 1 out of 10 people will get diagnosed with Alzheimer's. By the time you're 85, it's 1 out of 4. So it
Right.
it accelerates exponentially, which is why you have to practice sort of all of these brain healthy lifestyle habits to be able to prevent. I mean, as we age, I talked about brain volume changing, right? And brain volume shrinking and the hippocampus shrinks with age. But then if we do things like physical activity and physical exercise, that invokes neuroplasticity and that can help protect your hippocampus, the area of the brain involved in learning and memory. So that's why all of these things, it's really, I mean, the science is fascinating. It basically shows our brain is dynamic and the neuroplasticity can last, throughout our entire lifespan. So we want to make sure that we're, doing all that we can so that we can live, you know, not just a long life, but have a healthy lifespan.
Right. Yeah, I think it's even more important than, what do you call it? I mean, I guess life quality as opposed to lifespan.
They're both important, right? Quality of
Okay.
life is important, but you also, have to realize as you age, right, the tendency to get a degenerative disease, that risk goes up significantly, which means,
Yeah.
it's meaningful to start working on these things when you're young and healthy, right? If you can make the dietary
Yeah.
changes when you're young and healthy and get to the healthy weight, it's going to be easier than if you're older and then we now have to sort of unwind some of the habits that might not be serving you.
Right.
It,
Yeah, go on.
oh, I was going to say, most people, yeah, I think most people don't understand that the proteins that become misfolded and lead to, the pathology that we see in Alzheimer's, those start to accumulate a decade to 2 decades before we have symptoms. And so that's why, it's the kind of thing that we learn with neuroimaging. You look at the brain, we can sort of see these things happening, but then people
Yeah.
are living and they're cognitively healthy. So the goal is how do we help people build a cognitive reserve, right? How do we help people fortify and strengthen their brain so that even if these abnormal proteins are accumulating, you're not going to have the symptoms of dementia. That's sort of part of the goal and part of the why. Like, why should I care about my diet, right? Why should I try not to drink so much alcohol, right? Why should I engage in cognitively stimulating activities? Why should I learn a new language, right? Why should I
Yeah.
invest? Because I will say, and I know, we'll probably be wrapping up soon, but learning a new language is one of the best ways to preserve your cognitive health. It literally helps increase brain volume in multiple regions of the brain, in the prefrontal
Right.
cortex and the hippocampus and the temporal lobes. There's robust evidence to show that this is one of the best ways to help sort of preserve and maintain cognitive health as you age.
Right. And is there any reason why specifically language learning, is there anything different about it, or can I just play chess or other activities?
Well, I like that you do chess as well. Like that would be great to do both. But because of the complexity of learning languages, what it
Hmm.
entails, right? From memorizing the vocabulary to understanding the grammatical rules to learning the new sounds, um, to being able to use your brain to switch fluidly between maybe your native language to your non-native language. Learning a new language or being bilingual really works multiple brain networks simultaneously. You're
Okay.
working your hippocampus as you're learning new words, right? I think you told me, what is your vocabulary now? Like you're learning Japanese, right?
Oh, yes, right.
Yeah.
So, yeah,
And
I mean, thousands of
how
words
many
to
thousands of
learn.
words? Yeah.
I
So
mean, if you want to have a fluent conversation, it would be 5,000, 6,000, words. That's huge, yeah.
yeah, so every language that you have, you're expanding your vocabulary by 5,000, 10,000 words. So that's going to be working your hippocampus and you're going to have to
Yeah,
be retrieving those words and you're going to have to use your prefrontal cortex to figure out, am I speaking English? Am I speaking French? Am I speaking Japanese?
right, right.
All of that those are brain workouts, right? That's sort of complex cognitive tasks that you're asking your
Hmm.
brain to do, and you're asking your brain to work um, very rapidly to be able to navigate between the multiple languages. And so that's a full brain workout. The research shows it increases brain volume in multiple areas of the
Right.
brain. I mean, it helps improve connectivity between the right and left brains. And that's going to help preserve your cognitive function. So not only are you learning the new languages, but it's also just going to help you in your everyday life with working memory, attention, reasoning, information processing.
That's good news for everyone, listening to this podcast since we're already language learners. I
I
want to
know, it's
address,
impressive.
yeah, I want to ask about one last thing, which
Sure.
in my sort of experience at least, this has been the biggest differentiator in terms of cognitive performance, and this is
Hmm.
sleep. In
Yes.
terms of diet and exercise, I can see how these would influence cognitive performance. But in terms of sleep, as soon as you have just one bad night of sleep, at least for me, I mean,
Right.
my experience of the world is just totally different.
There's no question about this. What is the role of sleep in first preserving cognitive function over time?
Yes.
And what would you recommend that people do to optimize their sleep?
What a great question to end on, because don't we all love our sleep? So, truly, sleep is a time when our brain is working very hard to take all of the information that we learned during the day that's in our working memory and consolidate it into our long term memory. So, for anybody who's listening, that is, a language learner, you really need your sleep to be able to help preserve your memory, right? Preserve the grammatical. You're learning about all of the
Right.
grammar and the fluency of how to use the grammar. So all of that is happening during sleep. Another reason why sleep is important is it helps us to stay emotionally balanced. So one thing that people don't always appreciate is that while we sleep, we can actually unlearn fear related memories. So,
Right.
by going to sleep, it can help to reduce stress and stay emotionally balanced. And then, sort of, one of the third things that's really important about sleep is while we sleep, a system called the glymphatic system washes away a lot of the toxins and sort of the toxic accumulation of proteins that happen during the day. And it's one of the best ways to help prevent Alzheimer's disease. So,
Right.
if we have a night of no sleep, right, you're not going to have as good a memory. You're not going to have as good a recall. You're not going to be able to get that, the clearance of those abnormally folded proteins because that actually happens. That part happens during the first part of sleep, the non REM stage. Um, so, all of those things really are important overall to cognitive performance and brain health. I think it's sort of one of the strongest levers that you can pull, like making sure you're getting your 7 to 9 hours of sleep, that they're uninterrupted, because when you wake up, you want to feel cognitively refreshed. And when it comes to
Right.
language learning, and I'm sure you've probably already had somebody that's been on your podcast talking about this, but if you want to improve your language learning, do the studying right before you go to sleep. Right,
Right.
because if you
Right.
study right before you go to sleep, right, you're gonna now take all of that information that's in your short-term memory, and it can now be repeated sort of during that REM stage of sleep. That's the deep state, one of the deeper stages, where your brain is very active. It's gonna take all of that information that's in the hippocampus and transfer it into the neocortex and store it into long-term memory. So it's gonna be
Mhm.
great for your memory retrieval.
Right. Wow. Such great information. I think people have a lot to think about, including myself, especially with the blueberries and stuff.
Well, I think you've done
Um,
great. Well, I'm
oh, thank you.
impressed by all of the things that you've done and what you've learned, and I'm glad that the book was helpful for you.
Yeah. And so, Kristen, actually, you talked about a way that people can assess their brain health. Could you talk a little bit about this?
Yeah, so for anybody who's interested, I do have it's a 40-minute neurocognitive assessment that can be done online, and it is in English, Spanish, and French. So if people are interested in having that assessment that I can send out to them, I would be happy to do that for the listeners of your podcast for a reduced rate so they can come and reach
Sure.
out to me through my website. And I use this assessment annually with the people that I work with just to test and see how their cognitive function is over time. It can measure across 12 different cognitive domains.
Right. So I'll put a link to your maybe to your website for this.
Perfect.
Also, is there any other way that people can get in touch with you?
Yeah, if you go to my website and you'll provide the link, there's a place where you can reach out to me and ask any questions. So anything you want to know about what we discussed today, please don't hesitate to reach out and ask.
Well, Kristen, thank you so much.
It's been such a pleasure. Thank you for the honor of being on your podcast.